Well, actually, it was our social service that reported more and more patients needing counseling for financial distress or for financial concerns. And by and large, we see in general that the theme of financial toxicity, as it's called in the US, it's getting more and more momentum and impact as cancer patients live longer with the better therapies, but also are diagnosed earlier. And many of them are still in employment, so financial income loss or out-of-pocket payments get more and more traction also on patients' lives. So that was the initial, so the social service saying, well, that's not only a problem maybe in the US, but also in Germany with a third-party paid healthcare system. We wanted to look into that because there are no data so far, almost none, no data from Europe and none from Germany. So we started with a literature review on the kinds of measures, how to measure subjective financial burden at the patient level, and found that there is no consistency either with respect to the wording, financial distress, hardship, even to toxicity, and not to the concept, what constitutes subjective financial hardship or distress. So we started with that, looking for a measurement instrument, and didn't find one that was applicable for the more European third-party paid healthcare system and none in German. So we generated our own questionnaire about the relevant questions for patients, and then we asked 247 patients at our center about what they experience in terms of distress, and it was quite interesting. 80% said that they experience financial loss due to out-of-pocket payments, and 37% said that they experience an income loss. And while the out-of-pocket payments weren't a serious issue, not exceeding 200 euros per month for about 3/4 of the patients, the income loss was serious. Almost half of the patients reporting an income loss reported that it's more than 800 euros per month and going up to over 1,500. So that was one of the main findings, and we also saw that these financial losses impacted patients' quality of life. So in a regression analysis, we found that's a key factor, that patients with a relatively high income loss or financial losses reported a lower quality of life, and vice versa. Mainly three. First, we learned that we need a unified and harmonized instrument to measure financial toxicity in Europe, and need to adapt or need to generate a questionnaire that is valid for European healthcare systems and is based on the same constructs. Second, then we need to see whether the results of our center can be generalized to other cancer centers in Germany, but also in Europe. And third, right now already we kind of raised the awareness for oncologists to counsel their patients and be aware of financial topics as well as they are going through the care plan and making plans with their patients. So we have a very high sensitivity at our center now to refer patients who are at risk, young patients in employment with a longer cancer treatment, to the social service and get them consulted. So within this project, we still have one step further to go, and we together with a health economics department in Bielefeld, Germany, we extrapolate those data on health insurance data in general in Germany to see whether we find the same pattern that we detected at our center all over Germany. And then the next steps would be to consolidate a valid instrument that is applicable in Germany and other European countries, and see what big of a problem it really is, looking at Europe, and then to have a kind of risk score to detect patients at risk for financial loss early on and to consult them. And then there might be even more social, ethical and political implications that we need to think differently about financial support for patients. Our healthcare system is still from the 1930s-40s, where you had an infectious disease and either you died or you were back in the workforce. So you had to have only those 30 days of recovery, and the sick funds only pay for 30 days. So that needs to be changed with chronic diseases, but that's a more fundamental change that we envision.